Hi, I'm Dr. Rupinder Oberoi and I teach a course called Understanding Social Enterprise at the Design Innovation Center, University of Delhi. So while teaching this course, of course, we start with the definitional aspect of social enterprises, social innovation, why they have become so significant. But I think when I'm teaching the students, the concept of social enterprises is difficult to understand because we know that it is a very complex terrain itself. And the whole idea of being an organization which seeks to achieve dual bottom line, it wants to amalgamate the profitability along with the social mission or social solving of problems. It is difficult to convey and communicate to the students if we just delve into the definitions, the architecture, the theory of social enterprises. One of my favorite methods, and also I believe that students get to absorb the concept itself better, is when we run them through significant case studies or examples of successful social enterprises. The whole ethos, the mission, the vision of social enterprises and how they operate within the business terrain of market systems becomes more obvious, more apparent, more palatable, more acceptable to the students through these remarkable case studies which open the horizons and visions of the students itself, and they start trusting or start believing into the concept of social enterprises as a new model or a novel organization which is trying to be good to the society while also adopting the rigor of business practices. So within the case study methodology, one of my favorite case study is that of Arvind Eye Clinic. Now, Arvind Eye Clinic was set up in India, Tamil Nadu in 1976 by Dr. Govindarappa Venkataswamy. The whole idea behind setting up a social enterprise by Dr. Venkataswamy was that he wanted to bring in or emulate the efficiency of McDonald's, the fast food organization, and sought to adopt it in the eye care system. To cope with actually the increasing number of cataract patients in India, Arvind began by starting to perform surgeries on a large scale, and very often he was treating many of his patients free or at a very subsidized rate. If I have to quote Dr. V, as he's famously known as, he said, I quote, that if Coca-Cola can sell billions of sodas and if McDonald's can sell billions of burgers, then why can't Arvind Eye Clinic sell millions of sight restoring operations? I unquote. Now, Dr. V had a vision. He wanted to restore the gift of sight to millions of poor blind people through the Arvind Eye Care systems. Arvind's business model is based on the vision to solve the blindness problem regardless of the patient's ability to pay. Now, what is spectacular is that about 50% of the patients who receive the services at Arvind Eye Clinic actually get it free of cost, and or I would say at a highly subsidized rate. Yet the organization remains financially self-sustainable. Much of the importance is actually given to the concept of equity itself, thereby ensuring that all patients were accorded the same high-quality care and services regardless of their economic status or ability to pay. The critical component of Arvind's model is the high patient volume, which brings with it the benefits of economies of the scale. Arvind's unique assembly line approach increases the productivity nearly tenfold. So, if I have to just give it the remarkable statistical figures, Arvind Eye Clinic actually performs 4.5 lakh eye surgeries or procedures every year, and has become one of the largest eye care providers in the world. The whole business model of Arvind Eye Care Clinic is that it has a singular vision, which was chosen by Dr. V. That was that company has to focus on eliminating the blindness through cataract surgery. Secondly, it is a hybrid business model. The hybrid business model helps Arvind Eye Clinic to use the cash flows from the paying patients to cross-subsidize the services for the needy. Now, this model helped Arvind to develop specialty services along with basic cataract services and care. And what is also interesting is that Arvind Eye Care Clinic attracts and retains some of the best and qualified doctors. It has the concept of high volume, high quality, and low cost business model. To provide the perspective, the cost of a cataract surgery at Arvind could cost you as low as $50. So if you compare it with America or at USA, it would range between $3,000 to $4,000. So reaching out to the underserviced. So given that they had highly fragmented nature of customer base and due to the need of the scale, Arvind Eye Care Clinic has to generate demand through customer outreach program. So if we have to summarize in nutshell, what is Arvind Eye Care Clinic model? I can say that confidently that it is able to ensure quality, efficient services, giving value to the customer, high volume, reaching out to the people and continuing to be financially sustainable. So we can say that Arvind has been able to execute successfully the business model for almost now 4 decades and to become the largest provider of the eye care services in the world. Thank you.